Whether you're in your 40s, 50s, 60s, or beyond, maintaining good eye health is vital. I'm Dr. Michael Chua. I'm a board-certified ophthalmologist, and on a daily basis, I see firsthand how adopting specific habits can make a significant difference in preserving your vision. So let's jump right in. The first important habit we'll review is moisturizing our eyes. One of the most common complaints that I hear every day in the office, particularly as patients age, is the increased severity and frequency of dry eye symptoms. And this is backed up by research. A study from the American Journal of Ophthalmology investigated the prevalence, or basically what percentage of people have dry eye disease as a function of their age. What they found was that as we get older, particularly as we get into our 50s, 60s, 70s, and beyond, the prevalence of dry eye disease starts to increase significantly, especially for women. There are several reasons for this increase in the rate of dry eye disease as we get older. For one, our meibomian glands, which are responsible for secreting oil into our tears. Our meibomian glands decline as we age. As our meibomian glands are not as active, we have less oil being secreted into our tears. And this oil is very important because it helps to prevent our tears from evaporating. So we have meibomian gland dysfunction, which causes a weakened oil layer in our tears, which then causes worsened dry eye disease. We also often see a decrease in the activity of our lacrimal glands, or our tear glands, as we age. So with a decrease in our lacrimal glands and our meibomian glands, it's natural that we tend to see worsened dry eye as we get older. So what can we do about it? Well, it starts with a good dry eye treatment regimen. I found that using eye drops with an oil component, such as Retain, Systane Complete, or Refresh Mega 3, are particularly effective for managing dry eyes in more mature patients. Another habit to keep in mind is warm compress. Applying heat to the eyelids for about 15 minutes twice a day helps to soften the oily secretions in our meibomian glands and helps them to flow more freely. The next important habit we'll review is staying active. Research tells us that increasing our physical activity is one of the most powerful habits to increase longevity, and it's also important to maintaining our vision. For example, a research study from 2021 showed that patients who walked at least 7,000 steps per day had a 50 to 70% lower risk of dying. In terms of vision, we see many similar results. One of the most common causes of vision loss in patients older than 50 or 60 is diabetic retinopathy. Basically, when there's increased blood sugar levels for many years, these increased blood sugar levels can cause damage to the blood vessels in our retinas, causing bleeding and swelling in our retina, leading to loss of vision. And one of the most powerful habits we can maintain to protect ourselves from diabetes is, you guessed it, physical activity. A research study published in the journal BMC Public Health in 2020 followed 3,055 70-year-old subjects and found that people who walked at least 8,500 steps per day had a 63% decrease in the risk of developing diabetes. And for the other most common causes of vision loss in older patients, such as glaucoma, macular degeneration, and even cataracts, increased physical activity has been associated with lower risk of developing these conditions and losing vision from them. And this all makes sense. As we get older, it becomes even more important to maintain good blood circulation as well as to maintain our muscle mass. Daily physical activity, whether it be walking, jogging, swimming, gardening, or lifting weights, all help us to maintain our health and vision. For walking in particular, the published research suggests that we want to aim for around 8,000 steps, or about an hour of walking each day, to help us optimize the health and vision benefits. Okay, the next tip I'll talk about is UV protection. We know that many ocular diseases, including cataracts, tumors of the eyelid, uveal melanoma or cancer inside the eye, and macular degeneration are strongly associated with long-term exposure to solar ultraviolet radiation. And one thing we want to remember with ultraviolet exposure is that it's a dose-dependent relationship. That is, the higher our lifetime cumulative exposure to ultraviolet rays, the higher our risk for developing these conditions as we get older. And so UV protection is particularly important for patients who may be a little bit older, since these patients may have already accumulated a higher dose or longer lifetime exposure to ultraviolet radiation from the sun. Another important point about UV radiation is that long-term UV exposure can cause accelerated aging of the skin. This is a striking example from the New England Journal of Medicine of a truck driver whose face shows the effects of chronic sun exposure. Since he's a truck driver, the left side of his face was more exposed to the sun over the years, and you can see how this chronic UV exposure affected his skin. The left side of his face has deep wrinkles and areas of scaling and redness, compared to the right side of his face, which has a more youthful appearance. So for all these reasons, good UV protection around the eyes is critical. Always having a pair of wraparound UV blocking sunglasses whenever you'll be outside for extended periods of time is a good habit to have. Okay, The last tip I'll talk about is receiving comprehensive eye exams every 1 or 2 years or as recommended by your eye doctor. Some of the most common eye conditions we see in patients as they get older include cataracts, glaucoma, macular degeneration, and diabetic eye disease. In many cases, earlier detection and management of these conditions leads to improved vision outcomes for patients. I'll tell you, from my personal experience, and this happens to me on a daily basis, I have patients who are coming in for just a regular eye checkup without any complaints, and after a comprehensive exam, we'll discover that they have bleeding in their retina, or glaucoma, or macular degeneration. In many cases, luckily, we catch the problems early on, and we can work on lifestyle changes and strategies to try to prevent the conditions from worsening. But in some cases, such as advanced glaucoma or diabetic retinopathy, there's already a lot of damage that's been done to the optic nerve and to the patient's retina. And now we're left with more invasive options like surgery, lasers, or eye injections to help to try to either reverse or prevent more damage from occurring. So having a full eye exam every couple of years increases your chances of catching these conditions when they're more mild, and frankly gives us a better chance to help you save and maintain your vision. And if you live in the Los Angeles, Orange County, or Inland Empire area and want to get your eyes checked, feel free to visit our website or give our phone number a call to make an appointment today. I'm Dr. Michael Chua with Puente Hills Eye Care. See you next time.